Welcome to Simple Local Life, everyone. It's Jen, and this morning I am here at Earth Angels Home Care in Bridgewater, and we're carrying on with our Caregiving Talk series with Earth Angels. And I want to say good morning again, or I guess good afternoon. I think I do this every time, Tamara. The mornings fly by. But to Tamara, how are you?
I'm fine, thank you.
Good.
How are you?
I'm good.
Good.
A little snowy this morning.
It is. It seems like every time we meet, there's a little bit of an event with snow.
I feel like that too. I was thinking that this morning. So many times I've driven here in kind of snowy events, but let's just call it. This is the last snow day for this year.
Deal.
Okay.
Pinky.
Let's pinky swear on that. We're ready to be done with these. I know you guys are. So maybe, Tamara, just in case anyone is new to this series, maybe you could just introduce yourself and tell people what your role is here with Earth Angels Home Care.
So my name is Tamara Ballard. I'm a nurse and I work here at Earth Angels Home Care as the client care manager. So we're a home care agency and we provide services in the home for clients to remain independent in their homes.
Right, and we've, if it's the first time you've caught this, we actually have a whole series of videos we've done with Earth Angels Home Care. So if you're dealing with issues around dementia or Alzheimer's or interested in home care, you can just go on my video section, and Earth Angels has its own category there, and you can go back and watch any of those videos, or even check out the Earth Angels Home Care website, and they have some of them in there as well in their blogs.
Right.
So this afternoon, we're going to talk about a topic. I know it's kind of a bigger one, a heavier one. A lot of people struggle with this, but it's kind of around how do you know when mom or dad, we can say both, but let's just say dad, just for reference sakes, but how do you know when dad is ready to stop driving?
Right.
This is a conversation, I think, you hear people talk about it a lot, you know, and sometimes there might be a little accident or a little fender bender or close calls with loved ones when they're driving, and then it kind of becomes a heavy conversation because driving really represents like independence for a lot of older people.
Well, driving is independence, freedom, you know, it's mobility. And so really, Jen, what you're alluding to more so than just the, you know, when to give up driving, I think you're really talking about the person living with dementia and when they should give up driving, and some things that you want to look for. So we know that dementia, you know, causes, it's a series of symptoms that causes different things to happen in the brain.
Yes.
And so somebody that's driving might not have, you know, the quick reaction time like you or I would have,
right.
you know, and you want to be proactive when you're looking at somebody living with dementia and try to pre-plan when you want to look at when they should give up driving.
That's right. So yes, and that's an important distinction. It's if you have someone who has dementia or Alzheimer's, it's kind of an important topic for a lot of people as their parents are aging. But certainly then it kind of takes on an extra level of importance once you might be seeing signs of dementia or Alzheimer's. So the first step, I guess, is kind of watching for those signs. And then if you're struggling as a family to kind of know what the next step is, I think some people might think the natural next step would be in talking to their doctor about this. Is that something they should be talking to their doctor about?
Absolutely, but before you even talk to your doctor, you want to kind of look at some cues that you might be finding with your loved one, dad. So if you're in the car with him and you're driving and you notice like people getting irritated with him, honking the horn because he's driving too slow, you know, stopping at green lights, going through red lights, not being able to manipulate a turn properly, you know, some extra dents or something you're noticing in the car, or you know, not such a quick reaction time. So those are things you want to watch for before you even speak to your doctor about that. And if you're noticing some of those things, then you really want to, you know, start that conversation with dad, you know, about, Dad, you know, let's look at some options going further. Maybe it's time for you to retire versus quit driving, and maybe let's look at some options that you might be able to use to get around for your appointments and whatnot. Okay,
that's really good tips there, and just even that language, like you said, around it, like let's look at you retiring maybe from driving or something like that. So so let's say you're out with Dad, you guys are going for a Sunday drive, he wants to drive, you're going out to get your ice cream treat or something like that, and you do see a couple of these signs. If you haven't, like, I guess I'm wondering for families who maybe haven't yet had a diagnosis of Alzheimer's or dementia, like, but there are seeing some of these driving signs, Is that kind of like a warning sign sometimes for...
That could very much be one of the cues for a family member to say, hey, something's not quite right here.
Okay.
And, you know, jotting those things down so that when you do go to the family physician, you know, you can talk to the family physician, talk about, you know, I'm noticing some of these things with Dad, and, you know, especially when he's driving. So driving takes a whole series of complex reaction time, everything going on in your brain. It takes a series of complex things with what's called the executive function.
Okay.
And so when you can no longer do a series of things, it starts to affect. And then if you're noticing that, you definitely want to take that to your physician.
Okay, so if you're seeing a few of these signs, if there's been some other signs, like you said, good to always keep track of these in a notebook and dates around it, just so you can kind of refer back to it, because you can get, it can all kind of start to blur together after a while. And then maybe next step would then be going and having a chat with your family doctor.
Yes.
So if you're at that stage, this is something then you think you can talk about with your family doctor, and is there anything they can do to kind of help you as far as like a test or anything like that to see if should they still be driving?
Right. So the doctor's role, they're bound by most provincial laws, and they're ethically bound as well to report anything to the Department of Transportation. You know, if there is a medical condition such as dementia, they're bound ethically and by law to report that. So it's not the doctor's responsibility to remove the license from the client, but it's the doctor's responsibility to report that to the Department of Transportation. And so then the Department of Transportation would take that from there, and they would, you know, they would probably send a letter to the client saying that your license is being revoked, or the insurance company might pull the insurance from your car as well. So yeah, so it's good to be proactive and try to get some things in place before that happens.
Let's just say you go into the doctor and you say, look, I've been with Dad out a couple times on Sundays or through the week, and I've noticed a couple things. We've seen some other things. We're wondering if there might be some dementia starting or something like that. Is there a test a doctor can do to kind of help you determine that when it comes to driving?
So there's no, the doctor really doesn't test you for driving. He will do some cognitive and physical tests on you. Then that report would go to the Department of Transportation. There are some occupational therapists out there that might do some testings, and I know in the province of Ontario, there is a specified physician or occupational therapist that will take you out to do that driving test, but it costs anywhere from around $500 to $800. I'm not really sure that this province has that.
Okay.
Yeah, but I know the province of Ontario does have that. Yeah.
So sometimes then as a family, you know, any decision making can be just taken away from you in general then if your doctor has determined that there's signs of dementia or that your loved one has dementia or Alzheimer's, then they are legally bound to send a letter off and kind of get that reported.
Any medical condition.
Yeah,
so
any condition.
Yeah, so they're legally and ethically bound to report that to the Department of Transportation.
Okay.
It does usually fall back on the family to start to have that conversation with Dad to say, you know, Dad, you're not allowed to drive anymore. So that's why it's so important to be proactive.
Right.
And when you do have that diagnosis of dementia, Dad might still be able to drive in the early stages of dementia, but start that conversation early and get some things in place before that does happen. It makes it so much easier.
Yeah. If you guys have any questions while we're on live, by all means feel free to ask or send them along later if you're watching this when we're not live, because this is kind of a topic. I think it can be challenging, and for families themselves. I know sometimes, you know, certain family members might think it's time for Dad to give up his license, or it's time for Dad to retire from driving, but other family members might think like, no, you're overreacting, we're not really, Dad's going to be really upset with that. Like, how do you have any tips, I guess, on how families can kind of navigate that within their own unit?
And it does. It becomes a conundrum between family members, because one family member might say, just, I don't want to approach that subject. But then the head-turning question that we always like to ask is, would you put your grandchild in the car with your father? Okay. And that's usually the head-turning question that the family member says, no. So, you know, that's the question you need to be asking.
That's an important question, and something, yes, that definitely would get people thinking. And like you mentioned, being proactive, you know, is always so important when it comes to this. So what kind of things, I guess, would people can you suggest, like as far as being proactive, if you kind of are seeing the signs, you've been to a doctor, you're seeing that this might be something that you guys are headed to where dad or mom is not going to be driving anymore, what kind of things can people put into place, I guess, to kind of help them with that transition?
So here, I know in the town of Bridgewater, we do have public transportation now, which is great. Yes. So you can start looking at some of that public transportation. You can start looking at the seniors' wheels that we have, the volunteer programs out there that we do have. Yes. You can also hire an agency to make sure that they're getting their groceries and getting to their medical appointments on time. And one of the things that one of our clients, Karen Brown, was on our
video series, yes.
Thank you. Our video series not too long ago, and early in her husband's disease, she enlisted 4 friends. So four of her friends, you know, agreed for a couple hours once a week. So that's 4 weeks that they take her husband out for a drive or take him to an appointment. Yes. And you know, they do that, so it's being proactive again, so that it's not all on her.
Yes. Yeah. Those are great tips, and I think you're right. If you live in an area if you have public transportation, that's an option too. And just to clarify, so you guys here at Earth Angels Home Care, that is a service. So if someone was needing just some assistance, let's say, with making sure dad's getting to his doctor appointments or getting out to the grocery store, things, that's something that you guys can provide.
Absolutely. Okay. So all of our caregivers have a clean driving abstract, and they carry an added insurance so that we can transport clients to their appointments and such.
Well, that's a big relief in itself, because you know, for sometimes families are sometimes with these happens, you know, you hear about that sandwich generation where they still have young children and they also have aging parents, and it's hard to navigate all of that. So it's great that there's these kind of services around, and all the things that we mentioned. Well, this is kind of this is like an important, it's one of those more serious topics, and I know it can sometimes lead to difficult and sometimes hard conversations for family members and loved ones, and we're hoping that with some of these tips that you might be able to kind of navigate that yourself, or kind of have some things in place. I really think the proactive thing is important. I think
Absolutely.
For any parent who's aging, I mean, you don't, like you said, you don't have to be at the point where you have a dementia or a diagnosis of something, but certainly things to watch for as your parents start to age, or your loved ones.
Right.
Yes.
And you have to remember that driving is a privilege. It's not a right.
Yes.
It's a privilege.
Yes.
You know, and if you are no longer able to do that, then you know, we have to remove that privilege.
Yes.
So to speak, right?
I know a lot of people like to remind their teenagers of that when they start driving. No need to mention anyway. Mother of 3. Yes, well, this has been great, and I really appreciate this conversation. I think it's an important one, and another one to just kind of refer back to if you ever have any questions. And certainly you can always call Earth Angels Home Care here in Bridgewater, or visit their website to get in contact with someone if you do just like a little more information about kind of next steps if you see some of this, or about what kind of services that they provide when it comes to assisting families with their loved ones.
And there's also, Jennifer, there's also a lot of challenges, not just driving when dementia presents. So, you know, there's the you know, exit seeking, there's the I want to go home, or who's the paranoia, who stole my purse.
Yes.
We are having a free talk for caregivers on April 18th here at the Medical Arts Building from 7 till 8:30 on April the 18th. So if you'd like to join us, just give our office a call, 902-530-6205.
Wonderful. So yeah, that's a great chance to kind of come out and get some information and ask any questions that you have. April 18th here at the Medical Arts Building. Yes. Well, thank you so much, Tamara. I appreciate this. And thank you guys for watching. Have any questions, send them along, and we'll be sure to get those answered. See you later.
Bye-bye.